The think tank Policy Exchange has come out with a report calculating that low birth rates and the ageing population could result in government spending rising to 58% of GDP. And in the absence of increased economic growth, this would require an income tax rise equivalent to 7.4 percentage points. Quite an extraordinary figure, that, 7.4 percentage points. That is not nothing, is it? So I'm going to speak to the author of this report. It's called No One Left, Why the World Needs More Children. Dr. Paul Morland was the co-author of it. Good evening, Dr. Morland. Hello, Dr. Morland, are you there?
I am. Can you hear me?
You are. Yes, I can hear you now. Thank you. Can you tell us, give us a summary of your report, if you will?
Well, essentially, there's a sickness in our economy, and it's true of all of Europe and much of the rest of the world, which is that it's wonderful people are living longer, but they haven't had enough children. So the burden of the elderly on the working population grows and grows. And that means more and more spend just to keep things level on health. It means more and more spend on pensions and social care. And where we are today is much worse than where we were 20, 30 years ago. When we get to where Japan is today, which could be in 40, 50, 60 years, depending on how low the fertility rate goes and depending on immigration, then we're going to have to pay about 7p more in the pound on income tax just to stand still where we are if we're going to continue looking after older people, paying for the health care and the pensions of those who are retired. Now, one way of resolving that is ever greater immigration, but that just puts off the evil hour because the immigrants grow old themselves. We won't be able to ship people in en masse in ever-growing numbers forever. The only solution to this, the only solution to our economic sickness... But
the immigrants have children. They tend to have more children, don't they?
No, they don't. Immigrants actually arrive sometimes from countries with high fertility rates, but their fertility rapidly sinks. And of course, today, many immigrants are coming from countries that don't even have high fertility rates to start with. I mean, India is now down to about 2 children per woman. So India does not have a significantly higher fertility rate than us. It's falling rapidly. And when immigrants come, their fertility rate falls very rapidly. And that's true, of course, of people from Ireland, from Poland, from much of the world. Latinos in the Americas go to the United States and their fertility rate falls. So it's simply not true that immigration is a long-term solution to this.
Some would say, Dr. Morland, that the falling birth rate is a byproduct of the liberation of women from the home, if you want to put it that. You know, I wouldn't, that might be offensive to some people. I'm certainly not liberated from my home and I have 4 children. That's the choice that I made. But a lot of women are making a choice. I want to focus on other things in life. I want to focus on my career. Or I want to focus on, isn't it the case that the more educated and successful women become, if you go on that sort of metric, then the less likely they are to have children. So in some senses, people might think this is quite a positive development.
It's very laudable that women have the same opportunities as men. And in fact, we need women in the workplace. There's no point in saying we have a workplace problem and then hoping women go back into the kitchen. What we need to do is to invent a world, to reinvent a world where women have all the rights of men, all the career opportunities, and that together men and women produce enough children for a society to keep going. It's not easy, but it's possible. If we as a society prioritise that, I'm absolutely not calling for a reduction in women's rights or a reduction in women's participation. But we have to forge a society where women are fully participating in the workforce and in everything else in society. And together, with the cooperation, the collaboration, the hard work of men too, they're creating homes where we're producing our demographic future. And they're not abandoning the home altogether and abandoning having children, which actually is not what women want.
Dr. Morland, you say that if we created this world in which people were able to have children, I actually wonder if many people now want more than 1 or 2 children, because actually our priorities have changed and lifestyles have changed, and people might want, for instance, to prioritise holidays and lifestyle choices and having a beautiful home and so on, and having a car that they like. It's culture that has changed, hasn't it? So I know there are lots of policy prescriptions in general. Politicians say that we need to make housing more affordable and so on. And that is probably part of the answer if an answer is needed. But I just wonder whether this is just a cultural thing that policy can't really touch.
I completely agree it's a cultural thing. But people do say they want 2 to 3 children in most developed countries. But it is about culture. It is about priorities. But I think the culture has to shift. And I think politics can shift the culture. After all, politicians made homosexuality ceasing to be illegal in the 60s and got rid of capital punishment in the 60s. And it was decades before the public caught up with them in that respect. So in terms of changing the culture, we shouldn't think that the culture is just something that happens. Government can affect it. For example, we could teach in our schools how rapidly in your 30s your fertility trails off. We could organise ways for people to get a university education a little bit later in life and start having families and support them through university. There are also a whole range of things we could do to shift the culture. It's not just about throwing money at the problem.
I think, but culturally, just listening to that and how that it slightly enrages me, actually, because I started my family a bit later. I was 35, 36, and I think it just does women no favours to think they just don't know that fertility declines in their 30s. Of course they do. There is another cultural issue, which is that many men simply don't want to commit and don't want to settle down. And obviously the internet and dating and so on offers a world of choice, or they think they have a world of choice on their offer. And so I don't think it's the case that women are sort of blithely thinking, oh, well, we've got all the time in the world. I've got till I'm 45.
The data definitely does show that people do not correctly understand the speed at which their fertility trails off. But I completely agree. This is not just about women. It's about men. It's about men stepping up and taking responsibility. And again, only a shift in culture in which having children becomes a really exciting, cool thing to do, something people prioritize. That's what you need if you're going to have men stepping up to the plate. And it's absolutely as much about men as women. Now, I'm not saying we should return to the days of mass teenage pregnancy, but I think people should have options to start their families earlier if that's what they want. And we should break out of this thinking that you go to school, then you go to university, then you take a gap year, then you think about your career. And then sometime later, as your career has developed, you maybe consider having a family, because that works for many people and that's wonderful, but it doesn't work for everybody. And we will increase the fertility rate of the country if people have the options, the choices to start doing things differently. Not everybody needs to do everything in the same way, but we're making it really, really difficult to start a family early.
What though, Dr. Morland, of the environmental angles? Some would say, the planet is not designed for 8-odd billion people living on it the way we do. And they would say that if birth rates are falling, that's probably, as a species, it's probably a good thing if we occupy less of this planet. Don't you think we need to design a world which can accommodate fewer people and maybe utilising technologies like AI to do various jobs that people have done up to now?
Well, if you're living in a developed country and you're not having children because you think you're saving the planet, you're deluding yourself. Because what you're doing is you're consuming the labour of other people. You expect a doctor and a nurse, you expect a bus driver, etc., etc. You're not having children of your own. So what you then do socially, at a social level, is you bring in people from other countries. And those are usually low emissions countries. So instead of having children yourself, you bring people from low emissions countries to high emissions countries. Someone coming from Democratic Republic of Congo to Britain or Syria to Germany might increase their emissions 50-fold. Now, there are arguments about immigration. That's a different subject. But if you're not having children, you're consuming labour, you're simply drawing people from low emissions to high emissions countries. So that's point one. Point two is we'll only get out of our environmental mess if we have lots of brilliant, bright, creative brains. And brilliant, bright, creative brains in the past have made huge progress in terms, for example, of green energy. So an ageing society is not going to be the sort of creative society that gets itself out of these problems. And as far as AI is concerned...
But do you have... Sorry, Dr. Morland.
Sorry.
Do you have, or should we have, an idea of what the optimal national and global population should be? Or because it sounds a bit like let's just blindly have more and more people.
I think globally we're at 8 billion and we've never been better fed and better housed as a global population. There is room for further growth. I'm not saying we should all have vast families and the population of the world should grow and grow and grow. But what more and more countries are looking at, like South Korea, for example, is you have 2 people on average creating 2/3 of a person. So every cohort is a third the size of the last. That means 100 grandparents becomes 33 parents, becomes roughly 11 children. It's like humanity going down the plug hole. If people on average had 2 to 3 children globally, then the population of the world would ultimately stabilise and perhaps grow moderately. The problem is more and more countries are falling into the ultra-low fertility pattern where the population of the country will effectively just disappear, age rapidly, and then disappear.
Okay, thank you so much, Dr. Paul Morland, who is author of No One Left, Why the World Needs More Children, and co-author of this report from Policy Exchange, talking about how the falling birth rate risks adding 7p to income tax down the line.